Do you know how the brain and the hormones are affected when we have bariatric surgery?
Well, yes. So in a couple different ways. Um, we used to just call this weight loss surgery or obesity surgery. We now call it metabolic surgery because it sort of changes the metabolism of the patients. Um, and so when you do, let's say sleep is sort of the easiest to talk about. There's these hunger hormones, and there's a bunch of different ones, and they're extremely complex when you sort of like really get into the nitty gritty of it. But there's these hunger hormones that are made in the stomach, and in certain people who are overweight, they are overproduced. So it's your own body that's sort of like preventing you from losing weight and keeping you at a more unhealthy weight. There's factors that we can control in our weight, but there's all these factors we can't control. And so let's say, prior to some sort of procedure, somebody's trying to lose weight. They're just riding their bike or whatever. You're riding your bike, that makes all your hormones go up. So as those hormones go up, every pound you lose, it's just getting harder and harder and harder. And eventually, hormones win and, the weight kind of goes back up. And that's why people yo-yo diet like that with the sleeve surgery and all the other surgeries as well, but just in slightly different ways. As once you have that surgery, your hormones really like go to the floor. And that does a few good things. So, it monkeys with your insulin levels in a very good way. And it takes away a lot of those sort of like food noise, hunger symptoms in your head, not the good hunger like, oh, I need some protein, the hunger of, oh, those Cheetos look really good but I'm already full, kind of hormones. And so that's why surgery works, well. Other things don't work as well, because there is that sort of hormone brain connection in the head. So that's how the surgery hormonally works, mentally.
And by hormones, Dr.
Thank
Cribbins,
you.
are you talking about like ghrelin? That's
Yeah,
the one
like
we hear of.
ghrelin and gastric-related
Leptin.
peptide and leptin and all those sort of things.
Okay. Is it normal for patients, depending on the type of surgery that they've had, to see their hormone levels return? Maybe not to previous levels, but will they notice this big drop, and then is it kind of normal to notice them returning again?
Yeah, it definitely is. So in general, my experience, it doesn't get to sort of like pre-op levels. Um, but the surgery works. I don't know. Is it a year? Is it a year and a half? Is it two? The surgery does the best job with that, and then it does start to sort of more normalize. Um, like I was talking with a patient today. He's about 3 months out from a sleeve, and he's just like, I just have no appetite. Nothing tastes good. It's just all blah to me. Like I eat because I need, but it's just all blah, you know. And I'm like, it's okay. By about a year or so, you're just not that far from surgery. It's going to be a more normal relationship, with food and sitting down and enjoying it and sort of things like that. So yeah, it does come back to more normal levels, but it doesn't get to where it was, preoperatively.
Are the hormones that you're talking about only produced in our stomach or in like our intestines, or are they produced in other spaces and places of the body?
I really think they're just placed in the stomach.
Okay. So depending on the type of surgery that you've had, right, that's going to impact right, those hormones and how much your body makes of them afterwards, then, correct?
Yes. So the sleeve does it by removing those hormones, physically removing that part of the stomach. The gastric bypass also works in that way, and that's just a little bit different of it. Like sort of it normalizes and helps with all those hormones because there's something about, your food and your calories skipping that first portion of the small intestine that it does very, very similar things to that.
If you guys have not looked at today's 100-day challenge post, I highly recommend that you do, because in 4 minutes, you are going to watch 4 videos from the Mayo Clinic, and it does a fabulous job of showing how each surgery changes the anatomy. And in those videos, it actually talks about, right, in this part of the stomach, these are where these hormones are made. And that's why after surgery, patients can experience these kind of differences. It's a great 4 minutes, even if you're 5.5 years post-op like me, just to see the visual and to understand where how the anatomy changes, where it goes away, is an awesome just like piece to have up here when you're thinking about, hormones and all that kind of stuff. So if you haven't checked out today's post yet and that video that's linked there, I highly recommend you do.